Most rheumatologists don't consider themselves as pain experts, but all of us who treat patients, of course, are going to have to manage both articular and non-articular pain, but what I really want to cover is to speak to inflammatory and non-inflammatory pain. Regardless of what disease or diagnoses or what the patient has that you're treating, we all have to contend with this on a day-to-day basis. In late-breaking Abstract 03, Dr. Leslie Crawford from Vanderbilt studied TENS, Transcutaneous Electrical Nerve Stimulation, to help patients who have fibromyalgia. And the novelty about this study is a TENS device sometimes is used in physical therapy settings, but in fact is often not being used by patients in an outpatient setting. She randomized almost 400 individuals to get 2 hours a day of TENS with PT versus just PT alone. What she found is that there were significant benefits. 72% of patients found improvement in their pain compared to only 52% of individuals getting PT alone. The other thing that I find quite intriguing about this study is not only was movement-related pain improved, that's one of the features of her study, fatigue was better. And you and I have very little that we can do with good evidence about helping fatigue. So I think that the relevance here is that TENS is an old treatment, quite safe. She's shown it to be effective in patients with fibro, even coupled with PT, to benefit not only pain but fatigue. The second abstract I want to cover is an observational analysis out of Mass General, where patients who are taking tirzepatide, this is one of the newer GLP-1 drugs, in a very large cohort of 27,000 people, were shown to have a 10 to 15% lower likelihood of needing healthcare utilization for joint-related problems, as you might expect, mostly hip and knee pain and arthritis, as well as a 12 to 14% lower likelihood of needing opioids or NSAIDs. As GLP-1 drugs are becoming increasingly ubiquitous in our field, whether GLP-1s are going to be prescribed by rheumatologists, I think, remains yet to be seen. But some of the important benefits, I think, that both of these studies are demonstrating is whether it's a TENS unit or whether it's weight loss drugs that are now taking the world by storm, we've got some options to help manage non-inflammatory pain to benefit patients with fibromyalgia, like in the TENS study, or probably most other conditions that have non-inflammatory related pain.